and pleased to welcome Professor Dr. Virasak Meungpaisan, the Vice President and the Scientific Chair of the Thai Society of Gerontology and Geriatric Medicine, as our keynote speaker.
I'm going to talk about the aging and dementia, the trends and innovations. I will divide my talk into the three aspects. The first one is about the population aging and trends. The second one is about the innovations in terms of dementia. And the last one is about innovations in aging. As we all know that in the next 80 to 80 years in the future, the total populations in the world will be pretty much the same. Only in sub-Saharan Africa that the population will increase. Even in Southeast Asia, the population will be maybe slightly decreased, but there will be the higher proportion of older people in the population. This is the population over 60 years. In Thailand, we call 60 years as a cut point for aging population. There will be more and more the higher proportion of older people in less developed regions as compared to more developed regions. Therefore, any chronic disease that is very common in older people will be increased. This is the example of dementia. So the proportion of the growth of these problems will be much higher in low and middle income countries because we will face with the higher proportions of older people in our regions. And I think it will be the same in everywhere. This is in Thailand that we have lower birth rate and live longer. People live longer. And there are now the change in the family structure from the 3-generation structures into the 2-generation structure and no children family or one-person family or single parents. So the problems that we are going to face with in the future is the lack of family caregiver with the higher proportions of older people with chronic disease in our community. So with the challenge of aging society, there will be the many challenges. The first one is about the rapid growth of proportion of older people and the health consequence in their period is about chronic disease, the NCD, physical illness, the mood, mental health, dementia, frailty, and disability. In terms of the innovation and technology, we need the high technology to help us because we lack of informal care in the future. But the digital literacy and the health literacy is very low as compared to the rapid need that we really need in the future. And also the access to this innovation and technology, the cost, and to implement it in the routine practice is very difficult in low to middle income countries. In terms of the social, because of the smaller family size, lack of caregiver, and also the awareness of prepare for the readiness to be a rapid aging society, and also the home and environment, the problem about the design in terms of age and disability friendly design. Every building, every public space, every service, we must include disability and age and people with older people as our customer as well in every design. So the public service and environment are really need to shape. And the economic growth, with the economic growth, we at the moment we lack of the income and investment and saving in even in Thailand in older people. As compared to the pre-COVID-19 period, this is from the SCB EAC data survey from this year, to ask the people to rate their change of general health after the COVID period. And the majority of people, especially people with NCD or chronic disease, respiratory, liver, and renal disease, they feel like their general health is worse and much worse. As in every population, especially in Gen Z and Gen Z and Gen Y population, they report about their general health is much worse and worse as compared to other generations. And also, as compared to pre-COVID-19 period, at what level you pay attention to your health? And they answer that, I think around 80% of them answer that they pay more, increase their attention or much increase in their attention to their health. It means that after the COVID period, everyone pay attention to their general health and they feel like their health is much worse as compared to in the pre-COVID period. So the concept of aging well is very important in terms of to be healthy in their health status, their function, to be active in physical and cognitive function, and also the mental health, and to be productive and active in social participation and engagement. The concept of wellness to include in aspect of physical, mental, spiritual, emotional, social, and environmental are included to promote the well-being of all the people. And one of the rapid growth is about the tourism, especially the wellness tourism. The growth of the wellness tourism actually is much more as compared to the all tourism. And there are two types of wellness tourism. The first one is the primary wellness tourist, where they come to visit, for example, visit Chiang Rai for their wellness or health only, their main target. Or the secondary wellness tourism is something like they come to Thailand for the traveling and they spend some days in their wellness. But the growth of the secondary wellness tourists is much more, and the average expenditure per trip is actually much more in the wellness tourists as compared to the average tourist. So the trends will be the demand for providing care at a distance or telehealth or telemedicine has increased sharply during the COVID-19 pandemic. During the COVID-19 pandemic, I think everywhere, I think that the good thing is to accelerate the process of telehealth as we actually, before the COVID-19 period, we developed the telemedicine or telehealth, but it received more attention and more acceleration from the support much more during the COVID period. So the telemedicine or clinic online consultation is now very popular. And innovations in terms of the dementia. The ideal innovation should cover to be appropriate for the context, for the health problems, should be affordable for everyone, and should be acceptable. Many innovations are very high technology, but it's not acceptable, or it's not accessible, or it's not safe, especially for all the people where there is the disability of their change of their health condition. And many innovation is not proved to be effective in all the people, especially in people with dementia. People with dementia, usually they have the cognitive impairment in terms of memory impairment, visual spatial direction, impairment in direction, impairment in their perception, in language, or in planning executive function. And that leads to impairment in the activity of daily functions. And the majority of them have the BPSD or behavioral and psychological symptoms in dementia. So the burden from BPSD is very huge. For example, they may have aggression, irritability, hallucination, or wandering out from their home of increased falling rate. In terms of the technologies, previously we studied the majority of the study in dementia in terms of technologies focus on computer or tablet or laptop around 50% of them. For example, the platform, website, or social networking, or online course, video conference, or and followed by the robots and telephone and monitoring device in terms of the GPS, the camera, the sensor. Innovation in dementia could be divided into three important steps. The first one is to screen and early detection in terms of cognitive assessment and diagnosis. This is the longest standing use of technology in dementia by different methods. For example, the online assessment, the computer-based assessment, or in terms of the technology for early diagnosis of dementia. And then the second one is about the specific treatment in terms of the medications or the way of caring for people with dementia. And the general care is the term of safety to maintain their function and for their leisure and activities and for health in caregiving. The example of the first one, screening and early detection, is about the AI for dementia diagnosis. For example, the speech monitoring using the machine learning to analyze speech patterns to detect and monitor the dementia progression. And the medical image analysis to use the machine learning to analyze brain deterioration to predict the onset of dementia, or visual indicator to access eye movement pattern to track and correlate with cognitive function and brain activity, and also the genetic data to predict the onset of dementia. This is the example of the face and voice recognition identifies dementia sufferer, and they for the face detection and the voice detection, and also the speech analysis for the assessment of patient with pre-dementia or Alzheimer's disease. In dementia, when they have the symptoms of dementia, before they have the symptom of dementia, there will be the stage of MCI, where there is the cognitive impairment, but not severe enough to interfere with their daily functions. In this stage, there is some change of there is many biomarkers to be changed before the symptoms, and also at the stage of pre-symptomatic period where there is no symptom, there might be us who in our middle age or in when we don't have any symptoms, but there are change of biomarkers of the brain, for example, by the MRI, by the CSF analysis, and by the PET scan, amyloid PET scan or tau PET scan, or by the biomarkers of astrocytes function or microglia activation. This happen before the onset of symptoms. So when we use the genetic markers, neuroimaging, and CSF and peripheral biomarkers to detect the preclinical diagnosis of Alzheimer's disease, this is very popular at the moment, because the primary care physicians who are not familiar with dementia, who are not familiar with healthcare on the people, they collectively identify the presence of Alzheimer-related change only in 55%. It means that half by half, correct and incorrect. But when we use the blood test, so it did so more than 85% of the case. So to incorporate the blood test into the clinical setting where there is lack of experience of physicians and in terms of the diagnosis, it might help to diagnose more accurately. And in terms of specific treatment, management of MCI and dementia, MCI, the management focus on the lifestyle intervention. I will read only for the 3 or 2+ degree of confidence. It means that we have to ensure blood pressure is optimal, to control body weight, to do the smoke reduction, limited alcohol intake, physical activity and exercise, and treat depression and anxiety, and do the cognitive training, and to take care of the general health, because people when they get sick For example, they get hip fracture or they get pneumonia, their cognitive function will decline. Even it's not it's not the consequence directly to their brain, but their cognitive function will decline. So we have to maintain their general health, promote their general health, and also adherence to the diet with some evidence of benefit. For example, Mediterranean diet, mild diet, or DASH diet, and some of nutritional support. One of the landmark study is the finger study. You can search the finger study, and it has start in this area and then spread to the concept spread, and there is the cooperation of of this concept and studies through many countries in the world. It's focused on multi-domain intervention to improve cognition. So when we want to improve cognition, please don't just do the cognitive stimulation only, because we need the multi-domain intervention. It means that we need to control for their other lifestyle, for example, vascular risk factors, to check for their mood, depression, and anxiety, to check for their reversible cause of cognitive impairment, to promote the exercise and diet, and so many other methods that we need to focus, not just the cognitive stimulation. Cognitive stimulation is one, but not all for the intervention to improve MCI. So this is the systematic review of the multi-domain intervention. It focused, the mean duration is around 71 minutes, and per each session, 71 minutes, allow one hour each and per minute, and allow 2.5 times per week, and allow length by average allow 5 months. Our intervention usually lasted less than 1 year, and they show the short-term multi-domain benefit in terms of global cognition, memory, executive function, and verbal fluency. When we want to manage people with dementia, we have to focus on many aspects, not just by the pharmacologic treatment for cognitive function. We have to focus on non-pharmacologic treatment, BPSD, and general health to take care of their functions, to take care of their general medical conditions. People with dementia in the same stage and in the same age, they progress differently if they have the general medical conditions differently. For example, they have chronic liver disease, nutritional problems, pneumonia, or uncontrolled vascular risk factor. Their cognitive function and their dementia status will change much more rapidly as compared to people with stable medical conditions. So in terms of the safety and environment are also very important for people with dementia. Apart from getting lost from their house, they tend to fall down. They tend to take medication incorrectly. They might take some chemicals or use of the weapons in their family or something like that. So it's very dangerous in terms of the safety concern. And for the caregiver needs to be to have a skill and knowledge, and to check for their burden, because caregiver with dementia, they receive more burden as compared to caregiver for other conditions. And in terms of the rehabilitation, advanced elective or end of life care, do we already discuss with them how they want to live in their end of life? Do they want to receive the CPR or endotracheal tube intubation, respiratory support, or something like that? So we have to talk with them in advance before they developed dementia. At the moment in Thailand, we have the living wills that we can sign or express our living wills even we are not old. We can document it, and if, because when they got dementia already, they cannot make the decision-making capacity to do the advanced directive by themselves. So we need their caregivers to express this on behalf of them. And also the legal issue, this is the unique problems of people with dementia. They usually have the unique issue about legal issue. For example, can they sign some documents for their by their own or something like that. So when we talk about anti-dementia medication, it's just one piece of jigsaw, not all of the jigsaw of the treatment or management. So it's one of the important, but not all. It's something like when we think about MCI, usually we focus on cognitive stimulation. But as I just mentioned, it's not all, it's just one piece of the jigsaw. Also, when we talk about dementia, usually we focus on anti-dementia medication, but it's just one piece of the jigsaws, not all. In terms of because Alzheimer's disease has a lot of pathophysiologies. So when current medication, even amyloid targeting immunotherapy, it targets only one or two mechanisms. So it cannot stop or reverse the dementia conditions for the long term, because there are other mechanisms that make them getting worse in the long term as well. So the possible targets for innovative care for people with dementia would be to help them to orientate it in time, place, and people, and to help them for the judgment and planning for their life, and to help them in their memory impairment to use the sign, the note, the picture. In terms of safety, medication management, fire, electricity, wandering, fall, or cognitive stimulation. So the technology innovations for those with dementia, there are a lot of assistive technology. For example, the clocks to help them in terms of orientation, the communication aids, the electrical appliance or GPS location or tracking device, or home care robot, or home monitoring device, in-home camera, picture phone, reminder message, or use of the network sensor to monitor patients with dementia. It can predict the BPSD in people with dementia. So we have to manage the dementia-friendly environment. For example, we use the daylight illumination, the color of the room, the sound in the room, the smell, the symbol, the signs, the nature, the view, or even the pet therapy. This is, for example, people with wandering. They want to get out of their room every time. So it's this is the what we call the paper that we put on the wall, something that makes the door look like the shelf, the bookshelf, so they don't know that is the exit out to the door. So the plant therapy or pet therapy, or do we use the color? We use the color. For example, the room that we want them to be calm, we have to use some color. The room that we want them to do the activity, to be active, we use another color, and another sounds and another smell. So when we design the building or public space or maybe nursing facilities, we have to consider about this as well. The assistive robot to improve the emotional well-being and good memory of people with dementia. And it can make phone calls and remind people about their social event, or it's time for their medication already. So people could communicate with the social robot by voice, or by their face, or by feeling, by using a touch panel. In Thailand, I think the Ministry of Public Health tried to develop many dementia care model, the clinical practice guideline or the self-care to prevent dementia for early screening, diagnosis, and comprehensive care model and care manager. And for the diagnosis, the Department of Medical Service gather many experts in the field to help people in the rural area, because the primary care physician in the rural area, they cannot make the diagnosis by themselves for the dementia condition. So they present by the teleconference and present the case by the teleconference and ask the expert to share their experience about the diagnosis and the management of these patients. So they can learn. In the group there will be another attendance, the team, geriatric teams, and also the primary care doctors so they can learn from the case as well. In Thailand, it's not I think it's especially in urban area nowadays, when people comes to the hospital, people with dementia, they have different kinds of the tracking device. For example, this one where there's a telephone number on the what's called. And then also the wristband with the GPS, with the QR code. When we scan the QR code, there will be the history of that patient. But some people use the badge, or even you know something like the student that the name and the number, the phone number, contact number on their shirt, and also the GPS locations. The last one is about innovations in aging. Innovative for aging population. There are many innovations about the care, community and home-based care, for prevention and mobility, and for sensory impairment, for visual hearing impairment, for slow down the cognitive decline, electronic health and robotics, mobile health, elder-friendly medicine, social innovations, and age-friendly environment and food product. I will talk only in the red fronts, because we divided the stage of older people into 3 different stages. The first one, when they are at the high and stable capacity, then they have some decline in their capacity. And the last period is about the significant loss of their capacity. When they are at the stable or high capacity, we try to do the health promotion prevention to ensure early detection and control of their high stable. In Thailand, we use the elderly club, ชมรมผู้สูงอายุ or some many other maybe school for older people, โรงเรียนผู้สูงอายุ or something like that, to promote health promotion to maintain them in high and stable capacity. And even now there are many fitness for the elderly that will be promoted very soon. In the past, we have the fitness for all of the group of the everyone can go to the fitness, but in the future there will be the fitness focus on the elderly. So the trainer must be very keen to know about how to train on the people to do the exercise and something like that. For when they have the declining capacity, it's not very obvious. It's not obvious. For example, they walk slower, or they have some cognitive memory problems, but it's not so obvious. At this stage, we have to early detection to screen and try to reverse or slow decline in their capacity. But when they got significant loss of capacity, for example, they fell down with a hip fracture, or they have dementia, very obvious dementia. At this stage, we focus on manage advanced chronic conditions. WHO integrated care for older people, or WHO ICOPE, focus on 6 intrinsic capacity. That is the main component of everyone. The first one is vitality, which focus on nutrition, the visual, hearing, cognitive capacity, psychological capacity, and locomotor capacity. Then when we do the screen, there is the care pathway. The first step is to screen. I think this could be implemented in Thailand as well, because we have some the first doctors, which is the village health volunteer. The second doctor is the healthcare professional in the health promoting hospital, รพสต. And the third doctor is the real doctors or the healthcare professional team in the district community hospital. So we can integrate this into every countries. So we do the step 1 for screen of the loss in 6 domain of intrinsic capacity, and then followed by, if they are positive in step 1, we do the assessment in greater depth, and then we do the assessment and management of underlying disease associated with that domain, and management of social and physical environment. For example, people with high risk of fall, we have to assessment in terms of their home environment or assistive device or something like that about the social and physical environment. And then developed personalized care plan. I think this is the major pitfall in many areas, because usually we develop the care plan by the perspective of us, of healthcare professional. You have the high risk of fall, so you should do this to prevent fall. You have a high cholesterol or high blood pressure, so you should do this to control your vascular risk factor. That's not the personalized care plan. So we have to do the person-centered goal setting by including the patients and their family members and the healthcare team, multidisciplinary team, to make the care plan together, and then design a care plan including multi-component intervention, management of underlying disease, and then if the condition is too complex and cannot manage in the community, so we have to ensure the referral pathway and monitoring for the care plan and engage community and support caregivers. In Thailand, since 2021, the Ministry of Public Health launched the Thai Health Screen and Assessment for older people. It's covered 3 major groups, significant common disease in older people, geriatric syndrome and ADL for care. There are 9 domains of the conditions that need to be screened by step 1, village health volunteer or morning. Step 2, by the health promoting hospital or Lopasata, and step 3 by the community hospital. That's the innovation I think in the community care at the moment, in the past few years and in the next year as well, that we talk about the care plan, the 5 steps of doing care plan and screening in community. In terms of the food modification, older people usually they have the chewing problem and the swallowing problems. So there must be the concept of the food modification. For example, the easy concept, easy to chew, easy to digest, easy to open, easy to cook and prepare. And in terms of nutritional, low sugar, low salt, and low fat. And in terms of functional, the benefit to the heart, immunity, bone, or digestive health or brain health. Many texture modify food in terms of hardness, adhesiveness, or cohesiveness. To modify it appropriate to the level of chewing and swallowing capacity. Even in foods or drinks, we have to modify the thickness, the hardness, adhesiveness, and cohesiveness for the texture modified food. This is the example of mousse foods. I think at the moment, you can see in many supermarkets, especially in the big city, that there are the mousse food that is easy to chew and swallow, and texture softening, and also the 3D food printer to make the food looks very similar to the real food. For example, the print look like the conventional, Oral nutritional supplement for the functional food is very popular, for example, for cognitive impairment or for people with low muscle mass or sarcopenia. Also, the packaging design is very important. Mainly frequently that the package cannot be the design for other people with poor hand grip strength. So people cannot turn out to tie it down or remove the button or something like that, the cover. So the universal design is very also important. This is the coffee cup packaging recyclable. So the design must be nice to eat and to eat from an environmental friendly, enjoyable view experience and easy to open. And at the moment, the many package in the supermarket, you see the monitoring and indicator, for example, freshness indicator, ripeness indicator of the fruit, leak indicator, or time temperature indicator. This is for the home monitoring to prevent fall, to detect, for example, the signal, alarm signal, the assist, sorry, is very small. So that there will be the mattress and the mattress on the bed and the mattress on the floor. When they get out of their bed, it will alarm, and there will be the sensor. You will see it later. For example, anti-wandering, the floor mat cord, and also this is the bed pad sensor, or the chair exit sensor, or the anti-wandering for prevention wireless motion sensor, or the sensor at the door or exit alarm, or the nurse call button. For people with sensory impairment, for example, visual impairment, at the moment, there are a lot of advanced new lens implant, multifocal intraocular lens, artificial retina, or tooth implant lens in eye telescope, or many devices to let the blind see with their tongues. So they to help the improvement. So the visual aids can be computer screen magnification, text-to-speech software, speech-to-text software, and large number keyboard. And for people with visual impairment, there might be the talking, digital TV, or video game for visually impaired. So they don't need to see it clearly or to see it, but talk with the digital TV or use their hearing instead. And for the building and environment orientation, navigation tech, or outdoor navigation system for blind pedestrians using GPS and tactile feedback. Or this is the shoes and the cane that is the sensor to help them. The walkway improvement aids visually impaired. So when the design for people with disability, as I just mentioned, that for the environment or public space, we have to consider people with age or disability problems. Assisted vision smart glasses to help them to people with very little insight, to allow them to walk around unfamiliar places, or recognize obstacles, or to get greater independence, or the Braille ebook reader, or the finger reader. The fluid interface, they can read by touch on the books that they want to read. And the AI glasses, the combined glasses with stereo sound sensor and some other, we have to move. The middle ear implant for people with people with hearing impairment. The middle ear implant may be considered when a conventional hearing aids cannot be worn. So this is to implant into their middle ear instead of the conventional hearing aids. And the cochlear implant as well, by turning sound into electrical signals and sending them to the cochlea. Or even the brainstem implant, auditory brainstem implant. So they just implant the area position within the brainstem. So the external processor with microphone on the ear and receiver, and then they receive the signal to the brainstem directly. Or assistive listening device in some situation with people with noisy background or poor acoustic or distance, it helps them to listen more clearly. I think people with older people, they have many health problems. For example, dementia, Parkinson's disease, vision hearing problem, or cardiovascular disease, NCD, hypertension, diabetes, obesity, osteoarthritis, fall, wrist, and foot problems. So there are two types of the sensor. The first one is the physical sensor to detect the vital sign, the heart rate, EKG, respiratory rate, temperature, blood pressure, or oxygenation gait pattern, or the plantar pressure, the shearing, or the sleep pattern, or the chemical. It can detect the glucose level, the electrolyte, the L-DOPA, or many other metabolites. And so it is worn on the different part of the body. For example, the sock, the pentouch, console, or the finger, or many things. So the device can be the wearable physical sensors or wearable chemical sensors, as I just mentioned, and combine physical and wearable chemical sensors. And another sensor is non-wearable sensor. For the wearable physical sensor, it measures the basic vital sign, the temperature, the heart rate, the ECG, the respiratory rate, the oxygenation, blood pressure. It's monitor the mobility and including the step, detect fall event and assess gait disorder. And we can do the remote monitoring and do the virtual physical examination, not the exam in real practice. Another wearable chemical sensor at the moment, there are many chemical sensors. One of the landmark one is the glucose. So we push the sensor on our body so we know the glucose level. And also another one is about the sodium, potassium, lactate. So it's the non-invasive tracking of the change of chemical composition, such as sweat, tears, saliva, and interstitial fluid. So the wearable epidermal sensor, for example, the sweat sensor or lab on the skin, is a variety of metabolites and electrolytes such as lactate, glucose, sodium, potassium, and chloride. So in terms of the mix between physical and chemical sensor, so it's simultaneously tracking chemical biosensor and physical vital signs. It can be incorporated into smartwatch, elastic wristband, links, skin patch, micro needle, socks, shoe insole, or glasses. So then embedded into clothing or placed directly on the skin at different body location. This is a non-wearable sensor in home assessment. So there are many sensors around the home. So it's the smart home digital system to monitor the behavior. People with pacing around the house or wandering, or people with they want to get up many times at the night, or people with posture or movement problems, alert caregiver or healthcare professional of any abnormal, and monitor safety and health. I think in the future, in the long, not 2024 actually, there might be the combination of all the system. For example, the assistive robot pet, or the sensor integrate physical and chemical smart patch. So physical monitor the vital sign, the ECG, the heart rate, oxygen sat, temperature, and the chemical monitor the glucose, electrolyte, something like that. And the motor sensor and the smart carpet, smart shoes, cardiac monitor, and fall detection. And all of them are on the cloud server and machine learning. And the home sensor network, and we have the remote caregiver or remote healthcare professional, and the health monitoring, AI voice assistant, and digital health check. I think but I'm not sure that we want to be at this stage or not with monitor ourselves with remote assistant, not in person. But so the challenge of digital health in clinical practice in older adults is the limited digital literacy skill, very difficult for older people. Even some people, they can not use the smartphone, so it's very difficult there are a lot of digital literacy skill and data privacy, because all of our data and the security threats are on the cloud, so it can be hacked. and also the limited device performance. So this is the challenge of digital in the future. So what's next in the future? Smart home, as I just mentioned, smart home and facility, wearable sensor or home monitoring or telehealth. And telemonitoring, I think many of us might do some of the telemonitoring, telehealth, telemedicine already. So this need the training for the recipient or the family caregiver or the patients as well, and the network coverage. And at the moment, the sensor usually is the epidermal sensor, not the deep tissue signal. Deep tissue, for example, the ultrasonic sensor, which can do the ultrasound measurement and send the sensor. So this, I think the wearable sensor at the moment are limited to measurement around the skin surface, not in the deep tissue, but in the future, there might be the deep tissue signals. This is the smart home. So the smart home we should design for based on the level of frailty and level of presence of chronic conditions. Home monitoring system network, body-worn sensing device, electronic surveillance, and wireless communication network in the house. There must be the communication network, the cloud, analytic platform, and the home robots. So it can be used in the assisted living facility, not just in the home, hospital at home, home ward, or skilled nursing facility as well. The challenge in the future may be about, I think, the problem of design thinking. Usually when we design something, sometimes we do not include our customer in the design, on the adults, and we have to engage on the adults and seeking their input on design and operation. It must be user-friendly, and actually, the majority of older people, they still prefer personal contact more than the telehealth. Only if they have some communication problems or transportation problem, they might do the telehealth. And the limited digital literacy, and we have to consider about their physical limitation and cognitive impairment. And the good design should be the passive sensor more than active sensor, where there is no need for interaction between the patients and the sensor. It's automatically, not by the input we have to press something or to check something or something like that. Is not good for design thinking in other people. And the data processing and security is because we have the continuously monitor by many software. So the data is very big data. So the server or the cloud it must be very big, and the advanced data process or machine learning AI must be very precise, and in terms of data privacy and the performance gaps. Many at the moment of the device has the limited stability and accuracy, especially in uncontrolled conditions. For example, in different temperature, if it's too cold or too hot, or in different humidity or motion of the body. And also we need the large-scale clinical trials involving all the people to validate their accuracy. Usually, I have seen many devices when they developed in not in older people, not in people with disability. They asked people with maybe middle age try to fall down if it can measure or something like that, or people with healthy older people, 65, 70, but very healthy. But when we use it, with people with disability. So this is the performance gap that we need to be improved. And other issues about the cost, the device, and the accessibility. So I would end with the conclusions that the increased proportion of older people, especially in less developed country, is much more prominent as compared to more developed country, but limited informal caregivers. So we need the trends of the healthcare has changed after COVID period. And several innovation and technology grow rapidly to support the living and the healthcare of older people and their families, and also support the healthcare professional as well. but it need to be considered about the appropriateness, the affordable, accessible, acceptable, safe, and effectiveness should be concerned for the innovation in other people. Thank you.
We are honored to have Associate Professor Dr. Jude L. Tayaben and Dr. Pimrat Bunyapak as our keynote speakers.
Good morning, everyone. Greetings to all of you for your 25th anniversary of MFIU-AGING University here in Chiang Rai, Thailand. In behalf of Benguet State University, I'm honored and privileged as well joining you this conference. The topic assigned to me is about the role of innovation and the digital era in global aging and dementia. Probably it will take 30 to 40 minutes to complete my discussion. So hoping that you will get something from this presentation. I believe that we are coming from different backgrounds, researchers, educators, and of course in clinical practice. And it revolves around on those roles what I'm going to talk about this morning. But I would like to disclose that I have no conflict of interest, image, text, and other sources taken from various sources, no intended copyright infringement for this matter. Okay, the outline of my discussion is I'll start with introduction. Thank you, Professor Wirasarak, for started the role bowling, talking about the data that we're talking about, elderly and dementia. The roles of innovation and what would be the ways forwards that we expect to do for the next 10 years probably. Okay, in the realm of aging and dementia, innovation is the brush stroke that paints a brighter tomorrow. I hope you believe on this. In global aging and dementia care are undoubtedly current issues, but creative solutions are also being developed and becoming more and more prevalent, which Professor Wirasarak presented earlier about different innovative solutions about elderly care and dementia. If you look at this word cloud, you notice that elderly, aging, dementia are the prominent words that you'll see, which is now the current trends in issues that we need to focus for the next 10 years. But what is about elderly and innovation? Technological innovation into elders' everyday life and home care, take note of that, is an answer to prevent elders' dependence, take note, dependence, and also support their independence. That should be the direction of our mindset if we're talking about elderly today. And also, what is very important is acceptance of innovative technology in their everyday life. Is a success key factor to consider for all of us in the government, institutions like in the academy, technology providers, healthcare providers, and other major players in elders' life. According to WHO, in 2050, 80% of older people will be living in low and middle income countries. I'm assuming that Dr. Wirasarak presented earlier what would be the, no, but I'm not sure if Thailand is in the middle income countries or in the middle. It's like in the Philippines. So the pace of population aging is much faster than in the past. In 2023, for example, the number of people aged 60 years and older outnumbered children younger than 5 years old. So between 2015 and 2050, the proportion of the world's population over 60 years will nearly double from 12% to 22%. With the WHO response to these, the aging population is increasing. We have this United Nations Decade of Healthy Aging, which is between 2021 to 2030. It's timely in this celebration, we're talking about elderly care and dementia, which is also the priority agenda of the United Nations Decade of Healthy Aging, which is a global collaboration. And MFIU-AGING University responded on this call, bringing together people from the academy, from different government institutions, civil society, international agencies, professionals like us in the academia, and all of this for 10 years with concerted efforts in addressing this issue. And to address this, the UN Decade of Healthy Aging 2021 to 2030, these are the collective actions that focus on the 4 areas that we have to take note. Changing how we think, feel, and act towards age and ageism. Probably after this 2-day conference, we will realize how we could probably respond on the aging population in Thailand. Develop communities in ways that foster the abilities of older people. Deliver person-centered, integrated care and primary health services responsive to the older people. And lastly, providing older people who need it with access to quality long-term care. So these are the 4 directions of the UN Decade of Healthy Aging, which probably this is the direction of the MFIU-AGING University together with other stakeholders, moving forward in reducing health inequities and improve the lives of older people, their families, and communities. So the rapid progress in medical and nursing devices, clinical advancement, and others, we have observed the increased interest in engineering and innovative ways to healthcare delivery globally in elderly and dementia care. But if we're going to define what is innovation in invention, so that we just have a short frame about innovation, which is the theme today, the distinction of these two, if we're talking about invention, it's about generation of ideas and the first technical realization, which is the first that you will do. However, innovation is something like a more comprehensive process, starting with the generation of ideas and ending with the successful acceptance or adoption of your potential users. Okay? However, but of course, we know that both concepts are closely linked. Just to frame our ideas, if we're talking about innovation for my succeeding slides. Okay? Which Flesa and Hebner introduced to us some introduction about. If we're talking about innovation, we have to consider, I'm not sure if it is clear in the presentation, macro level, the global scale, the meso level probably, and also the specific users of the innovation. This is particularly on micro level. And also, in the model of adoption of a healthcare innovation, you start to innovate, then the process is follows promoters, if you look at the center, and also adoption. So all of this you have to consider as factors until you end up with adoption of that innovative solution. And also, I'm not sure if you're familiar with this, the technology readiness level. It follows several levels until such time the technology is being accepted. However, that is only the introduction of my talk. Allow me to, these are the 4 actually, the roles of innovation that I'm going to talk about this morning. I would like to explain how innovations have the potential, to improve healthcare system for the aging population and give dementia care as a priority. We will describe the various frameworks, technologies, tools, and systems models that can be used to support interventions in the healthcare system. Third, healthcare systems may achieve the quadruple aim of enhancing patient experience, improve population health, reduce costs, and also improve provider satisfaction. And lastly, the role of innovation is the responsibilities of nurses like us that will play in Healthcare 4.0 and Industry 4.0, which will focus on smart and connected healthcare with an aging population at its core. So in some manner, defining the crucial responsibilities enables us to consistently focus healthcare innovations and advancement on improving the health of this vulnerable group. First, how innovations have the potential to improve healthcare systems for the aging population, and it will give dementia care as your priority. In the presentation earlier, they're talking about the number of persons aged 65 years or over by geographic region. If you notice, in Asia, it's really big, no? In terms of the projected percentage by 2050, like in Thailand or in the Philippines, the Eastern and Southeastern Asia, it's 120%, no? Increase. It doubles the number of people aged 65 or over in 2050. Looking at this image, that is also the direction in 2030, no? Healthcare spending is on the rise with 75% of spending due to chronic care. Of adults 65 and older, 67% go online. 80% own a cellular phone. And I know everybody has their own cell phones. 40% own a smartphone. 85% of adults 65 and older want to stay in their home. And community as the age, that is the frame that I would like to emphasize. In Asia, they ask a question about family care models, right? We have this extended family. Unlike in Western regions or Western countries, we are more on family-oriented type, which the extended family or our family members would like to take care more of our elders compared in other Western or in other countries. And also, 1 in 5 households provides care to an elderly or disabled individual who requires assistance. The number is expected to grow to 1 in 2 by 2030. Which suggests, in several studies conducted, JBI also, in terms of the role of innovation, in terms of helping the healthcare system, in community-based telemonitoring on self-care is very important, which suggests they have their recommendation that consider telemonitoring as an intervention to improve self-care behaviors among adults with heart failure in the community. On the other hand, telemonitoring chosen by healthcare providers from the different modes of telemonitoring interventions ranging from simple telephone supports to advanced remote monitoring devices based on available resources, which somehow it tells us that it's very important to maximize all of these innovations. And also, as I mentioned earlier, it's evident now that community and home-based care could be simultaneously reduce costs and improve care. So it's not the conventional thinking which we are always on we bring patients or elderly to the hospitals or but rather it's more on home care and community-based approaches. It has the essential benefit of improving autonomy on the part of elderly and giving older individuals the power make their own decision over their health and daily living despite of their problems. Okay. In particular, innovations can, there are solutions that promise enhanced mechanisms on dementia care. For example, they can manage their lifestyle. They can monitor their own cognitive performance, ensure the security and safety of the elderly, and also through innovation, it will deliver rehab services. And also, if we're talking about dementia care, if talking about innovation, it can be either patient-centric or caretaker-centric. So these are the two. If you're talking about patient-centric, you're talking about the lifestyle. You're talking about behavioral and psychological symptoms of dementia. On the other hand, caretaker-centric is about the caretaker, the one who takes care, the dementia patient or patient with dementia, stress reduction and counseling, right? Enhancing awareness, training in patient management. In other words, through innovation, you're not considering only about the patient alone, but rather you have to consider as well the caretaker. So it comes hand in hand with the caretaker if we're talking about community-based approaches. The practical use of innovations, if you're talking about healthcare system, like for example, with the use of technology-based devices to track and manage the lifestyle habits of dementia patient. For example, the wearable smart watches or skin-friendly patches, all of these are some examples of devices that would track and manage lifestyle habits. It will enable the innovative solution to analyze patient data and create also actionable insights. Who among in this audience wearing a smart watch? Yan. Do you maximize the data that gather? Dr. Malcolm is, yeah. Even me, I can monitor my pulse rate. And I know if it is, increasing pulse rate, you have to rest, right? You respond immediately because of that smart watches, meaning you believe so much on the data that, that project in your watches, which is good because we're talking about innovations. Role 2, innovations as well will support the various frameworks, with the use of various frameworks, technologies, tools, and systems models, especially those researchers doing studies about elderly care. With the aid of frameworks, of course, it will help us, or it will guide us in the direction to produce a better result of our studies. In the Global Patient Safety Action Plan, it's the same with the UN, which I mentioned earlier, 2021 to 2030, the WHO underscores the need for national policies and strategies. If you're talking about patient safety, which is currently probably in Thailand, you're doing all of this, surveillance and learning systems for safety incidents and the like. And there are various frameworks or models that have been developed because of these innovations to guide us how to understand, design, and implement technology, and also to find balance between the benefits and successful adoption by clinicians. For example, if you're going to use frameworks, I know you're familiar with the technology acceptance model, right? But it follows also the unified theory of acceptance in combination with the use of technology and the rest. There are several frameworks that will guide us in terms of the role of innovative solutions. Another is the quadruple aim. Are you familiar with the quadruple aim? This is introduced by the Institute for institutional improvement, or healthcare improvement, Institute for Healthcare Improvement. There is a triple aim in 2008, then they revised to quadruple aim in 2014, which they included another aspect, which I'm going to talk about in a while. There are many studies using this framework or conceptual framework to analyze or understand on how innovative solutions will direct us. If indeed they are, it can be good for adoption or useful in a particular population. Like for example, in these slides, using the quadruple aim to understand the impact of virtual delivery of care in Canada, community health centers. Another example, they use the quadruple aim as their framework in terms of the perspectives on the use of telehealth for older adults during the COVID-19. And I hope you can use this as well as part of the framework when you're talking about innovative solutions among elderly. Which leads me to the third role of innovation, which it helps us to achieve as well the quadruple aim to enhance the 4 areas. Quadruple, there are 4. In 2008, there are only 3. Triple aim. In 2014, they revised or improved that makes it quadruple. In the triple aim, there are only 3 aims: patient experience, improve population health, and reduce costs. But because of the quadruple aim, they added one, which is to improve provider satisfaction on the part of the one who will facilitate the use of the technology. So with the use of this technology and tools, somehow it helps us to improve innovative solutions. So if you're talking about improved population health, there could be equitable and timely access to care, improve population outcomes, and so on. If you're talking about improving provider experience, you're talking about work-life balance. For example, the healthcare provider or the caregiver. You have to consider the caregiver on how they improve their experience as well while they are facilitating the use of that technology and others. In this particular slide, Chong et al. And colleagues, they use the quadruple aim to analyze as their framework in their study, as their guide until the outcome measures. I will not dwell on more on this, but if you notice, there could be the models of care for frailty ready in the emergency department, then the emergency department disposition outcomes. Then it follows with the aid of the quadruple aim, they able to understand in terms of the outcome measures that will be the direction of their study. And the fourth one of the role of innovative solution is our responsibilities as nurses will play in the healthcare 4.0, industry 4.0, and also the connected healthcare with an aging population at its core. What is healthcare 4.0? Are you familiar with this? Yan. Before, of course, the time of Dr. Malcolm probably, they realized the healthcare 1.0. Then it follows the healthcare 2.0. Now, in our time, we are now in the healthcare 4.0, which focus more on the smart health, connected care, personalized medicine, and artificial intelligence. Which connects me, if you notice the arrow, going back to the patient encounter, which we always realize that it's not only robotics that we're talking about. It's always the human experience. It's always the human touch, which I would like to articulate in Asian countries like Thailand or in the Philippines. We are more on the human experience, right? Which also, the healthcare 4.0, if you notice in this figure, it's about patient involvement and responsibility. Which leads me to this. It aligns as well to the industry, because if you're talking about innovative solutions, at the end of the day, you're talking about the product that you develop, and it could become a business model, right? So industry, it aligns with the industry. Which the industry 4.0 now is about cyber physical system, the IoT, the cloud manufacturing, and also what is in now, or probably what is familiar to us, is the big data and AI. It aligns with the healthcare 4.0. Okay, which also about the connected health, which is the current trends now in terms of innovation, which is there are only 3 areas that you have to focus if you're talking about connected health. It is about remote, smart, and precise. If you're using a smart watch, probably that is has something to do with it is a remote monitoring. It should be smart to measure. And of course, it should be precise as well to measure about, for example, your vital signs. Okay, through information and communication technologies. And there are 3 examples here: remote healthcare, the smart-oriented innovation, which it will deliver better health outcomes, and also precise healthcare, which I believe the smartwatch that you're using, it collects data in a timely and seamless fashion. Okay, precise healthcare. Which always, it brings us always, even there are things like this, at the center of everything is always the patient. Remember that. Okay. Part of the solutions or part of the role is with the use of powerful infographics. You can go to this website, the National Institute on Aging, and you will find several that can be shareable, that you can share in your social media. These are powerful infographics pertaining to aging and aging-related health issues. Or probably, you can facilitate. Students here can develop their own powerful infographics, and it can be used in their own community. Okay, so the end of my presentation. So what is now the role of innovation and technology of us nurses? The digital health platforms for the elderly. However, there are some barriers that we need to address according to the latest study that we have to take note. Even it is innovative, advanced, smart, all of this, at the end, we have to remember that elderly have the challenges to adopt and the use of digital health platforms. It's always challenging for us. That's why the role of nurses should be facilitative in terms of adopting these innovative solutions. Another barrier probably is the negative attitudes and technology anxiety that prohibits initial adoption of that innovation, right? What is worse, the lack of trust that prohibits both initial adoption and subsequent usage of that innovative solutions. And also, the proactive application development and education activities that can facilitate adoption and usage. Which, in this slide, you will see, those are the barriers that I mentioned, the attitudes, technology anxiety, and the trust. However, the paper suggested some ways of addressing the barriers that includes the main function of the nurse could be on the general education. More on general education. Because if there is no education or empowering, right, no, in terms of community approaches, it could lead to non-adoption of that innovative solutions. Another is research. You will find in this slide some research themes in terms of the drivers of dementia, or I mean dementia care, okay, that may consider in your future research endeavors. Okay. However, I would like to end my discussion pertaining to what Robert Nieves, that for a safer patient world, we need empowered nurses to lead innovation. Do you agree? Yes or no? We need empowered nurses to lead innovation. No offense to the doctors, but I think most of us are nurses in this hall. Okay? Which, Nieves, we have to go back to the basics. I know that you're teaching about nursing informatics, right? So you have nursing informatics in your BSN curriculum. Like in the Philippines, it is integrated as part of the curriculum, the nursing informatics, which the 4 tenets of informatics, it's always go back to this basic understanding about informatics, identifying until knowledge and wisdom. We should understand as well the content, the workflows, culture, and technology when you're addressing about informatics or nursing informatics in any innovative solutions that you would like to introduce. So as I said, you go back. Rather, you equip your students in education platform, equip our students in terms of how to maximize their nursing informatic concepts and use this as well as their facility in terms of doing research. For example, in the College of Nursing that I'm representing, the development of risk assessment mobile health applications for older adults in La Trinidad, in my town, which we tried to develop, the students and faculty tried to develop some risk assessment mobile health application that can be used by the healthcare providers, be it a midwife or nurses, or we have volunteers as well in the community, the barangay health workers. So in the lower part of the slide, you'll see num-num. Num-num is the brain. So with the use of a risk application, so probably what I'm trying to tell you is localize. There are probably some, WHO and some agencies introducing some risk assessment tools, but rather localize it because I believe we are rich in terms of culture, or some ways we have to prototype as well, some solutions, for example, in this study, which they introduce this in the community in our place. Okay, so the College of Nursing or the School of Nursing somehow can lead in some examples that you can innovate, and you can introduce that to your community. In the ways forward that I would like to end, because of the rapid adoption of digital health technologies and patient-centered care, us nurses can play a pivotal role in the transformation of healthcare, which we believe no? Because though there are changes in roles, how we work, the technologies we use, in the overall movement towards digitalization, also, it has something to do with these three specific areas. Remember this, there could be big data and digital health. That's the direction of this. Increasingly empowered patient population and the implementation of the blended clinical environment. With the future healthcare models to be successful, despite of the different frameworks or models that I introduced earlier, it always leads to this, the empowered patient and also the empowered clinician. The empowered clinician with the right knowledge that you will use, the right clinical decision support tools that you will use, and your ability to act is needed to deliver high quality and safe patient care, which healthcare organizations must foster a culture of empowered patients and clinicians, which in the next 10 years, according to this data, the professional skills that requires us to embark or enhance to ourselves is about technological competence, which relates to innovative solutions. Talking about clinical knowledge, the communication skills, critical thinking, and of course, your knowledge about data, analysis, and statistics. That offers the future direction of innovative solutions. But going back, in the first bullet, if you notice, it's always the healthcare now that we are doing or focus in the directions of patients' home, not anymore in the traditional healthcare setting like hospitals and clinics. Okay, I think that ends my presentation. So any learning insights to end to this discussion? In the symphony of global aging and dementia, innovation is the conductor, orchestrating a harmonious blend of compassion and technology in the digital era, transforming challenges into opportunities for a brighter and more connected future. With that, thank you so much for paying attention.
Good morning. How are you? Are you still okay? Yes. Can you give me a mini heart to sign of ready to listen? Okay, that's great. So after we are listening to the Dr. Virasak, our keynote speaker, and the Dr. Jude, and I gonna talk about the role of innovation and the digital era in the global aging and dementia as well. But there are lots of things that our keynote speaker and the Dr. Jude already mentioned. So some slides I will skip that to accelerate the time for you to have a break. Is that good? Okay, so I won't take too long to talk about, to present our this topic. Dr. Jude already mentioned about the key fact of the dementias. So we know exactly what is the population that aging, right? And the number of people who have dementia globally is over the 55 million. And also the dementia has the seventh cause, the rank is the seventh rank of cause of death among the people around the world. And it can lead to many problems like a disability and also dependency. And so it is the case that now we are living in the aging era. We are aged every day. And now the life expectancy seems to be longer and not maybe more than 70, right? 70, 80 and more. So that means the longer person lives, the greater that likelihood of dementia. Do you agree on this statement? Do you? Okay, great. So we can move on. Okay, so the question is, how can we improve the health and well-being of those affected by dementia, both for the present and the future generations? As a role of healthcare provider, it's not only nurse, but also for the term of physician of any kinds of healthcare professions. Because now it is the fact that every 3 seconds, someone in the world developed dementia. And by 2050, it is estimated that over the 130 million people worldwide will be living with dementia. So it is the case that we have to do something. And Dr. Jude already mentioned about the innovation. We should lead something or do something. So today I'm going to present about how we explore, do we know about the innovation and digital era can offer the potential solutions. And I'm going to focus on something that more precise or specific is called design thinking. Have you ever heard the word design thinking? Yes. So I can end my talk for now because you might already know. I can end my talk. By the way, I prepare it. Just be patient to listen to me, please. Okay, so I divided into 3 parts. The first one, what is the health innovation? And the second one, I will talk about what is design thinking. And the last one, how does design thinking relevant in healthcare? Here, the first one, the first area or the first aspect that I want to talk. What is health innovation? Who can answer me? Who can tell me what is health innovation? Do you want to try? I believe you know, but you don't want to say something out loud, right? Okay, by the way, I will give you the definition from the WHO. WHO states that defines health innovation as a new or improved solution with the transformative ability to accelerate positive high health impact. So there are many innovations. It can be referred to a process, a policy, a product, or either a program that can enhance the quality of life, even in the individuals, families, or communities. Do you want to guess? Here, this slide, I show you the trend, the healthcare trends and innovation that gonna occur in the next year. Artificial intelligence, Internet of Things, telemedicine, big data and analytics, immersive technology like AR, VR, mobile health, 3D printing, blockchain. Have you familiar with the word blockchain? I hope that next May we will receive it. Cloud computing, genomic. Do you want to guess which one is a top rank? Which one is the top one in this trend? Which one? Do you want to guess? AI? Who think AI? AI. Who think mobile health? Okay. So, and who think of telemedicine? We heard a lot, telemedicine. Okay. So the next slide is going to be the answer. The top rank is artificial intelligence, approximately 18%, followed by the Internet of Things, and then followed by the telemedicine. For the mobile health, is approximately 8%. And immersive technology is quite similar, quite the same as the big data analysis. We can still use the VR or AR to invent something, to create something. So I won't go in depth for the example because this morning our keynote speaker gave a lot of example, a wonderful example of innovation. I'm gonna move to the next areas. You said that you're familiar with the word design thinking. Who can give me a brief definition of design thinking? Design, thinking. So think, design, right? Yeah, okay, thank you, by the way. Okay, the word design thinking is the first mentioned in 1969 by the Herbert Simon. He was a cognitive scientist and he received the Nobel Prize. He mentioned the design thinking is a non-linear interactive process. It is the human-centered approach. As Dr. Jude said before, that is we are the Asian region, Asian population, so we have to focus on the human touch, right, Dr. Jude? So design thinking is a human-centered way to focus on what is the most important for our user. So our user can be like a patient, your caregivers, as well as can be your even the staff as well. So we use this approach to tackle ill-defined and unknown problems. And the innovator can have the freedom to generate groundbreaking solution. How many steps, how many phases of design thinking? When we want to approach or use this methodology to our project, we have to know exactly how many steps, how many phases. So do you remember the first step is? I know, you want to help me? The first step is empathize. And the second one is, okay, yes, define. Thank you, Dr. Jude. And the third one is, see, ideate, right. And followed by prototype. And then test. And it's a non-linear process, interactive non-linear process. Remember that one. So how does design thinking relevant in healthcare? Design thinking has been used in various healthcare settings for now, and various conditions as well. For example, physical conditions, mental health conditions, as well as system processes. So healthcare system require continuous innovation to meet the needs of patients and providers to enhance efficiency and effectiveness. Unfortunately, some of our innovation is still on shelf, is still unused. Why? Why it happened? After we create I think we create a great innovation, but it's still on shelf. It's not generalized or used in the real world. What is that? What is the problem to cause this one? So maybe because of the process, or maybe it's not answer, your solution is not answer the real need of your user or your customers. Maybe, I'm not sure. So by the way, I will go in depth in each step or each phase of design thinking. The first step is to empathize. You have to understand your user, understand by asking the question and listen what is their needs. The first thing is very important. You have to understand, put yourself in your user shoe. This is very important. This step, you have to understand there are many techniques or many ways that you can gain the information from your users. For example, you can asking the question. After asking, you have to listening. Use the active listening to understand what they want. Is this the want or this is the need of your user? And then you can use like a focus group interview. So there are many techniques that you can gain the information. So after you gather all information, you're going to move to the next step. It's called define. It's time you have to find out what is the problem. What is the pain point of your users? Have you familiar with the word pain point? The pain point? Yes, the pain. You have to solve the pain of your user. So that is a very important. This step you have to define. After you gather the data from the previous step, you have to find out is not, you have to find out the pain point, or is the real problem. It's not the superficial problems. That is a very important. Then prioritize area where innovation and technology can offer the most significant impact. Move to the next one. After you're done with this stage, you're gonna move to the next phase, or it's called the ideate. It's time to think. It's time for playful thinking about what is the kind of option or the solution that we can solve the problem. So this one, we can use a lot of techniques, but the mostly common techniques is brainstorming. And another one is you can use like a six thinking hats. Like you can ask your team to think in this perspective, or another one think in another perspective, to draw the option as much as you can to generate a creative idea. Then you have to find out which idea or which solution is the best to solve or to answer to your equation. And then you select the promising ideas and develop quickly, or develop the prototype. Not the too expensive, just develop the low cost prototype and then test it. This stage is time like an experimental stage. So you go, after you mock up your solution or your prototype, and then you go to your potential user or your selected user, and then you test it. When the time to test, you have to use like an interactive testing and ask them for the feedback. That is a very important. Feedback is a very important for this step. Ask them, and what do they think? And any suggestion from them, that then you can refine and improve the solution. After that, it seems to end off the 5 phases of design thinking, but I would like to emphasize this one as well. You have to add on this phase or this step that is called implement and share. Think like you do the research, right? After complete your research project, what do you do? After you complete the research project, what do you do? Pardon? Celebrate. Okay, yay, I'm done, right? But before celebrating, what did you do? Generalize it, publish it. So this is a very important step as well. Do not omit or do not forget to this phase. You generalize it. By the way, in some, there are 6 points that for you to checklist. The first one, begin with empathy. Empathize your user. Define the problem. Check. The third check, ideate on the possible solution or not. And then prototype the options. And then test the usable prototype. And the last one, last but not least, implement and share. Even you implement and share, you still gain the feedback from your user as well. And you can improve it after you receive the feedback. This is a loop. It's a non-linear interactive process, as I said. So, design thinking is not just for designers. Innovation essentially means a new idea, right? Design thinking is a problem-solving methodology or approach that helps you or your teams develop new ideas. In other words, design thinking can lead to innovation. Remember that the purpose of design thinking is to delight user and to do so. The process employs method that mix of science and art. Science maybe include technology as well, with creativity and innovation. For a nurse, we are not keen on the technology, so we can seeking for another person or find a team that keen on the technology, right, Dr. Jude? We can collaborate to other professions or another area. So set up the team. So again, design thinking is human approach, human-centered approach. I would like to end my talk by using by this quote from the Melinda Gates. Human-centered design is about meeting people where they are and really taking their needs and feedback into account. When you let people participate in the design process, you find that they often have ingenious ideas about what would really help them. Thank you.
Is our virtual panel discussion on aging and dementia innovation and technology. The moderator, Dr. Piyatida Jullapiya.
Good morning, everyone, and thank you so much for a lovely introduction from Ajahn Nataya. After listening to all our speakers this morning, I think everyone feel that we are relevant to the topic, also to this panel session. The topic is on the aging and dementia innovation and technology. So according to the WHO Global Action Plans for the public health response to dementia, 1 in 7 areas of the action is dementia research and innovation. And also the UN's Sustainable Development Goals, for example, the goal number 3, the good health and well-being. Number 9, industry, innovation, and infrastructure. And also goal number 11 is sustainable cities and communities. All of these emphasize the significance of this topic of the panel. In this session, as Ajahn Nataya mentioned before, we have 3 panelists. One is on site, sitting here next to me, and another 2 speakers are virtually with us. Each of them will give a 20-minute presentation, and after that, we'll take questions from the floor, and the panelists will share their thoughts with us. So first, let me introduce to you our professor of a global career program from Faculty of Social Science, Kyorin University, and also the adjunct professor at School of International Liberal Studies, Waseda University, Japan. Professor Dr. Malcolm Field from Kyorin University. And our second speaker, he joined us from the Philippines. He is the program chairperson on the Master of Arts in Hospital Administration, Master of Arts in Nursing, and PhD in Nursing at San Pedro College, Nursing Department, Philippines. He earned his PhD and Master's in Nursing from San Pedro College. He will present the Philippine context of the innovation in dementia management. Please join me to welcome Dr. Samuel Mikalos. And our last but not least panelist also joined us virtually from Chiang Mai, Thailand. She is an assistant professor in medical nursing at Chiang Mai University, Faculty of Nursing. So please, she will talk about the innovation in prevention and caring for the persons with dementia. Please join me to welcome Assistant Professor Dr. Sirirat Pan Uthai. All right, now we know our 3 speakers. So to spend the time wisely, I will give you the floor, Dr. Malcolm.
So since we are still warming up, I would like you to look at this QR code. You know Mentimeter quite well, and I will ask you a couple of questions as well before we listen to me speak too much more. Okay, that's fine. There's lots of good answers coming through there. I see computer is reigning. AI seems to be the strongest response with computer. Smart. Computer is smart. Interesting. So that's an interesting answer, and thank you for those feedback. Here, I think, is the next question. What do you understand by the word dementia? Again, you need to keep your answers to 1 or 2 words. Okay, I think we can see a pattern developing there as well, in particularly forgetting being the key word or the strongest response, and slow being another one. And yet there is a wide variety of other words that are being used here to try and describe dementia. And that is actually very important as we go through to see that. I'm going to stop sharing this particular screen and go back to my PowerPoint. So if you just moment, but thank you for that. I'll go back and check the results later and make them available. Okay, so we need to ask the question, what do we understand by the word technology? And I asked that question to you immediately, what was happening. And I think this is important because what we understand by the word technology is really depending upon your position and what we understand personally about technology. And that very much influences the way we understand it. And in 1900, that's over 120 years ago, a man called Jean-Marc Cotet, he's a Frenchman, he was asked to create 100 images of what he thought the world would look like in the year 2000. And these are just 2 of his images that he came up with. Some of his ideas were really crazy, like people riding dolphins. Others were, although looking a little bit strange, we can actually recognize that they are in our modern world. And this one I put here because I believe, particularly in Asia, the hair, which I don't have much of, is quite an important part. And so I put these here, and I wondered how many of you would be willing to go to an AI barber or a hairdresser that's run by robots. And usually the response when I ask this in my courses is 0. But technology has always been with us. Technology has always been around to get us to improve our lives. And there's nothing really new about it. So we perhaps have now become a little bit scared of technology or overwhelmed by it because of the rapid paces and changes that are happening. But 100 years ago, in the years of Jean-Marc Cotet, the world was rapidly changing there. Then as well, there are many, many new science discoveries happening at that time. And people were really, excited and really quite scared about what was happening. So this is, again, a repeat of what was coming before. And perhaps most of us today think of technologies, our first thought goes to our computers and our social medias. And these are the kind of things that we tend to think about at first recall. But for me, it's not there. I'd like you to have a quick look at this one. This is Japan's push to a society 5.0. And it's worth looking at because you can see what the Japanese government is pushing in a digital economy in Japan. Oopsie, come back.
The fourth industrial revolution will enable us to create a new society. Artificial intelligence will transform the big data collected through the Internet of Things into new wisdom. Society 5.0, a technology-based, human-centered society. The fourth industrial revolution will raise our standard of living and solve various challenges we face. It will, for example, free us from the stress of driving, allowing us to safely visit anyone, anytime. We will have access to the latest medical advancements at a low cost, no matter where we are. AI and robots will enhance human ability and expand our infinite possibilities, helping us enjoy more fulfilling lives. Society 5.0, for the betterment of human lives.
I think the key points to take away there are it's human-centered and it's about human lives. And this is a point I will come back to over and over again in this next 15 minutes or so. The other interesting thing to notice was Jude talked about health 4.0 and Japan's talking about a society 5.0. And this is another interesting constraint that we have to face in the world, is that we all are working off different paradigms. And we perhaps need to get together and figure out how to solve these solutions together, rather than necessarily always going one way and saying one way is the best. It's an interesting idea as these things come up. Okay.
The fourth industrial
I'll go past that. I'm waiting for those bugs to come out before I get too excited about too many of these technologies. Because there's still many, many things to work out. And there's a lot of hype around a lot of the discussions of technology. Okay, so I'm going to go back to what do we mean by the word technology. And basically, we can talk about technology from a low tech to high tech. And low tech can be simply something like assisted walkers. And high tech can be anything from AI to robotics, to skeleton robotics that help our nurses pick up patients by themselves. So there is this whole spectrum. And within this spectrum, there are many different kinds of technologies. Now, the Aged Care Research and Industry Innovation in Australia have a very good website, and they outline quite a number of technologies that I think are being used. And they were also outlined this morning by the keynote speakers, which I thought was fantastic because it made me feel good that I was kind of in the right area when experts are talking about this as well. So let's keep moving. So we have social technologies, okay, and we all use those all the time. And please do take note here. Something interesting about these images, I hope that you use your powers of observation. These images are AI generated. So again, this is technology at use. We have wearables, whether they be smartwatches or the new devices, goggles coming for AR and VR, or all sorts of other wearables such as fall devices, GPS trackers, these sorts of things. These are wearables that are around. Smartphone apps that are there. Many of those now available. Even for care workers, these apps are available to help relieve some of the stresses of their work. Our smart homes, we saw examples of smart homes before, and so I won't go into too much of that. And AI, of course, which is the big talk at the moment around, particularly if we're looking at how do we implement AI and robotics together. And we need to remember that AI and robotics are not necessarily the same. We often hear robotics, we think AI, but actually they're quite separate. They're different areas. These are the kind of technologies that we've been looking at. And with robots, particularly, this is an area that is progressing very quickly, and many people, unless you're watching it, don't realize the advanced silicon that is going on the outside of robots. It's not just the furry little toys and the robots that look like this now. Robots are becoming to look like humans, particularly in Japan, through the advancement of silicon technologies. Now, what do we mean by dementia again? I'm using the word agility. I know I saw this morning people are using the word capacity. I tend to prefer the word agility, but I'm not an expert in the area. That's from my background. And physical capacity, and again, this is on a spectrum. As we've heard this repeated this morning, from mild loss to severe loss. And we need to understand this spectrum very clearly. I mean, it's a very important spectrum to understand, because it influences the kind of technologies that we can actually apply and how we apply those technologies. And so we take that further. You see a spectrum here from severe to low and across the bottom. I cannot see it because of the way this computer is set up. Drats, I've been cut out at the bottom. It's the setup of the computer. Yahoo! Great, nothing I can do about it. It's just set up of the computer. But they can see it on Zoom. Sorry about this, but on the bottom line, it's social. It's basically about institutional support, okay? And you go from low support to high support, and then you have a cutting across there like that, and that basically people will fall somewhere on that spectrum on the kind of support that's needed. And that support that is needed, or the amount of independence that somebody has, really again affects the kind of technologies that we can recommend and how they will be used. And so these are these basic things that I'm trying to, I know you know these things, I'm just repeating in a kind of an academic form in some way. All right, I got to keep moving because of time a little bit. Now, what was really mentioned this morning, and I thought it was fantastic again, is this assessment rubric, trying to understand where people are in not only the stage of aging, but also in dementia. And we often, particularly in public spaces or in the general population, can easily conflate the ideas of dementia and aging together, and they're not the same. Dementia may be a result of getting older in some cases, for sure, but aging also has its own challenges and its own advantages that maybe not without dementia, but still they might need assistance in certain care. And the reason I've added this in here again, I think this is particularly important for nurses. We talk about doctors making these assessments, but often it's front line of the nurses. And so the nurses need to understand the skills and do the preliminary assessment. And from those preliminary assessments, based on whatever technology or online or digital assessment tools that are available, they can then recommend the kind of ideas that were suggested this morning in the first three presentations. So that's why I mentioned that. Now, being an academic that I am, and one that is kind of a little bit tired of everything having a binary answer, it's either yes, no, on or off, I decided I better myself try and make it into a simplified binary diagram and put it all together. And so again, we have the cognitive ability, mild loss to severe loss on one end, and then with technology, we can go technology that is self-managed. Individuals can do it by themselves, or care workers, if you like, to autonomous, such as robotics, that do it for you. And along that, again, we can see that how we use or apply that technology will depend upon where the individual is in this particular diagram. All right. So basically, the severer the loss, the less the person is able to self-manage, the more it's going to go into the autonomous robotic end of technologies, whether that be devices in homes, in smart homes, or in care centers, or it be just wearables, which again I will talk about in a minute a little bit, the issues with these, to if you are more capable, more agile in your thinking and in your physical capability, then you can manage a lot more by yourself. I'm going to show you an ABC News video in a moment, and that sort of fits in that spectrum there, around that area, somewhere around that area there. And again, I'm mentioning the rubric system. So here is that Australian Research website page. It's a good page because what they do talk about is aged care. And I think this is important. When we see the aged care, it's not always necessarily talking about people with dementia. And so some of these technologies may not actually work with people with dementia. They just may be completely useless in some of these ideas. So we need to look at these ideas through, here are their ideas, artificial intelligence. We saw these this morning coming out with the first presentation, some very good ideas, so I won't repeat them and go through them. An idea from Japan, with a social welfare corporation called Zenkokai. You can see they have these very big buildings where people stay. And they, again, are using quite a number of high-end technology devices, mostly hardware, but there are software and going on, and we saw one of the examples this morning being produced. And the thing about Zenkokai is they have great sponsorship. Okay, they have companies that are putting a lot of money into helping them test and use their technologies. And that's something that's really missing in the general population. And here's an example. Of course, I have a sleep scan, and I've got a few minutes, but you can see here, it's a bed. This mattress goes under the bed, and that senses how people are sleeping, their heart rate, their blood pressure, all sorts of things they can sense with that. That is automatically fed back to a smartphone app that the caretaker has, which is a real assistance for the caretaker because they don't need to actually walk around as much as before, perhaps. They have much more real-time feedback. And you can see when you have a big building like this, that is a big help rather than having to keep up with everybody. All right, let's press on. That's their video, please. Worth checking out their webpage. They are really testing some really high-end advanced stuff in their facility. Here is the Australian one. I'll just play this quickly. Sorry, I'll go.
We're all living with dementia, and we always ask people what kind of technology they want. And so at that stage, we had the idea of creating an interactive digital character. So it wasn't AI, that came later, but it was a realistic companion character. And we were really thinking about what if we had like a form of slow TV, you know, a character not kind of ear bashing all the time, not overstimulating, but just kind of sitting with you, who could respond and talk to you. And so that character of Viv emerged, and she shares the characteristics that those women we worked with had.
Okay, intriguing. It's interesting that I read that Viv evolved from an audio-visual artwork to a robot that can interact with people. Now, what have you learned about people's reactions to Viv when they interact with Viv?
Yeah, so we learned a lot from the women with dementia who helped create her, and what they told us from the get-go was that people are actually not very skilled in empathizing when you have dementia, and this includes people in the medical profession. And all the women said, you know, they get annoyed by being infantilized, treated like children, the assumption that they've completely lost it. And what's happening is, you know, sometimes memory drops out, sometimes there's confusion, but they have a lot of insight into what's happening, and they have ways of working through. So they all actually experienced hallucinations, auditory and visual hallucinations. And they had ways of kind of verifying. So they'd sort of sit and breathe, take another look, and work out whether, you know, the mind was playing tricks or whether this was actually a real thing. So this is quite helpful to learn from people who manage their symptoms really well. We're all living.
So I think that's important. Some of the things are important there. It's about people, learning from people. It's about trying to empathize with people. The other thing that's very clear about that is that there's a mixing of terms immediately, robots, AI. And that was very unclear from that particular clip whether that was an avatar or whether it was actually a created robot, and I believe it's still an avatar. And they're talking about generative AI, these language models that are able to interact with patients. These cannot, we often hear about ChatGPT or GPT-5 coming next year. We hear about these things. Some people are scared of them, some people are not. These generative AI can now be made bespoke. So you can put them, they will be able to be put on your own computer so that they can learn about you and interact with you as you go through. So again, these things are changing in a big way. But one of the questions we're going to have to ask is about cost. Are these costs going to come down? Some people believe over time will costs come down. At the moment, they're way too expensive for the average person to be able to use these things. If you're in a high-end facility, yes, they are definitely possible. I don't know. This is the future. And the current economic and financial models don't give me a lot of hope to think that these prices are going to come down. Basically, we know these factors. One thing, ikigai, that people don't perhaps know about, and it's really important. This is a Japanese word. Basically, it means a passion. You have something that is driving your life. Okay, it's something that really interests you, whether it be art, whether it be your work, whether it be helping people, whatever. That ikigai is important, and if we lose that ikigai, that is a really crucial step or risk factor into heading into factors like dementia. Now, I'm sorry, I know the time's up, but I want to follow this through. I think it's important. At the moment, I believe a lot of what we're talking about is dealing with what's happening now. And I know this morning was a little bit talked about what is coming with the future, 2050, 2030, and the aging populations and dementia. David Sinclair says we have to shift the mindset, and I agree with him, and start talking about people and thinking about people throughout their whole of life before they get sick. So that means we have to start thinking about you as well, and the people in their 40s. And this morning we showed a thing about mild, cases of being diagnosed with mild dementia. This is a time where we need to step up, really clearly, even before that, but we've got to step up and start taking factors. And one of the things is an economic reason. Let's just talk economics. According to these people, they say that it'll increase the global economy alone. One extra healthy lifespan, one extra year of healthy lifespan will increase the global economy by $38 trillion. And in the US, they talk about it as $86 trillion alone. Now, this is massive. Now, we can say, well, how can it be 38 for the whole world and 86 for just the US? Well, it just shows you how much the US consumes and buys, okay? And this is the big difference. But these are just huge, massive factors about this. And there are a couple of extra references I have added in, and I'll give you a moment if you want to take a screenshot. They are not on the slides that you can access later. So if you want to get those 2 good readings about this discussion, feel free to access them later. Okay. This is a video. I'm not going to play it because of time. A video I made. It's about ageism in Japan. You can check it out on the PowerPoint. So sum it all up. We need to take positive action, and some of these are systemic actions, and such as stopping the early retirement. Stopping people from retiring early is one thing that we need to rapidly change and give that option back to people. We need to increase our social systems and increase the way we support people so that we can reduce the costs. And it is all about dignity and empowerment and connectivity. We must get back to that, not about thinking about costs. It's about people. It's about giving them dignity and cost. Technology must equal empowerment. It must be about agency, connection, and dignity. Without that, we won't have a meaningful life. And I think that's extremely important, that we must understand it is about people. And if we stop thinking about people, when they're gone, we will be very sad that we didn't take the opportunities to treat people as people. Thank you very much.
Thank you very much, Professor Malcolm. I know that you speed up very quickly for us. Thank you for that. And I think he made a very good point about tailoring or customizing the innovation for each individual. And also he mentioned about the high-end innovation, but also their limitations, right? That Professor Paisan talked about it this morning too. And I think it's time to move on to our second presenter. Dr. Sam, are you here already?
Yes.
You stop sharing, please?
Dr. Kai.
Yep. Good morning. So
Good
we'll
morning.
stop sharing and then
It's
we'll
still
let
morning
you
in
share your slide.
Thailand. Okay.
Can you share your slide now?
Okay, I will. Okay, so dementia is a growing health priority, and Alzheimer's disease is the most common dementia subtype. It is expected to hit 12 million older adults in Southeast Asia by 2050. In the Philippines, a baseline community study found a 10.6% prevalence. Despite the results, a national dementia plan is yet to be developed. Furthermore, the Philippines is projected to be one of the countries that would experience the consequences of the rise in dementia cases if left unprepared. The National Dementia Plan must then consider the current state of dementia in the country and the risk factors associated with it for better planning and disease prevention. Good morning, ladies and gentlemen. Sawadee Krap. I'd like to present this morning innovations in dementia management, Philippine context. So from diagnostics to cognitive improvement, we observe a steady stream of breakthrough tools and technology that support people living with dementia and caregivers. In 2022, the Alzheimer's Disease Association of the Philippines, or ADAP, collaborated with Memory Lane Games, a digital startup recognized by ORCA. It's an accrediting body for digital health solutions, to develop customized workouts for those with cognitive impairments in the Philippines, such as dementia and stroke. The app or the application was launched in April 2021, and since being publicly available, the app has had over 17,000 downloads in the Philippines. During the pandemic, it is reported that only 35% of persons with dementia reported being able to see a doctor in person. This according to the World Alzheimer's Report in 2021, Journey Through the Diagnosis of Dementia. Memory Lane began to build a tailored version of the app for the Alzheimer's Disease Association of the Philippines. The app, which provides, number one, a multitude of different cognitive games. Number two, hundreds of images around familiar Filipino images. And themes were selected, including that of original Philippines music, street foods, history, over 100 local towns and villages. According to Bruce Elliott, the CEO and co-founder of Memory Lane Games, games are designed in such a way to provide a frustration-free experience based around favorite and familiar topics, and there are no scoring or time limits. Furthermore, he said, the games have also been carefully chosen to create an enjoyable experience for both people living with dementia and caregivers. And the ultimate goal here is to have a platform that stimulates conversations and memories. Dr. Gemily Cano, an ADAP board member and neurologist, said, there are advantages in using Memory Lane games. Number one, it encourages positive social interactions between family carers and those affected by dementia. Second, with more progress stages of dementia, family carers have noted that the game helps in improving their mood, making taking care of them easier. She further said that during COVID-19, because they had quarantine restrictions, the app served as a brain exercise among Filipinos. Thank you, Captain Cap, and have a pleasant day.
Thank you very much. We hope to, we expect to listen to you more, Dr. Sam. I think, but we can save your time and maybe the floor have like other questions for you at the end. So please stay with us. I know that the Philippine time is like 1 hour ahead of us, but I think you already had lunch, right?
Yes.
So you need to wait for us. All right.
Yeah.
So thank you very much for your sharing your experience from the Philippine context. So we are going to move to our third presenter, Assistant Professor Dr. Sirirat Pan Uthai from Faculty of Nursing, Chiang Mai University. Assistant Professor Sirirat, are you here with us?
Yes.
Okay, thank you so much. Oh, now we can see your slide.
Yes. Okay, I'm start.
Yeah, please.
Yeah, okay. Thank you very much for giving me an opportunity to share this topic with all of you. And Sawadika from Chiang Mai is very close to Chiang Rai, so I cannot attend the conference. So thank you very much again. So for my presentations, I would like to focus on mostly of my presentation is focused on the role of nurses in caring for persons with dementia, and I might start with maybe some speakers might talk about the prevalence of dementia in Thailand. So we all know that Thailand be similar to other countries all over the world, that we move to the aging and age societies, and the proportions of people at 60 and above is going to reach 20%. And in the near future, we are going to move to the super age of societies. It's very rapidly, the number of the people. So the prevalence of dementia is increasing rapidly as well. So in 2015, it's about 600,000 patients with dementia, and mostly people at 60 and above. And in 2030, it's increased up to 1,115,000. And in 2015, it's doubled into about 2,000 people that be affected by dementia. And mostly for the people. So compare between 1530s and 2000. So the numbers of people with dementia increasing very rapidly as well. The same as maybe in other countries all over the world. So this is compared with other countries. And Philippines, the prevalence of dementia is higher than in Thailand. Yeah. And Thailand has a very unique advantages and challenges in caring for people with dementia. So right now, the national dementia strategy has already been launched based on the previously developed care and support policy for the elderly. So we are lucky that we have the policy on dementia care, but mostly people, especially older people with dementia, most of them live with their families in the communities. And the main caregivers are the family members. And also the responsibility of the communities to care for dementia people with the family members. So the Thailand policy, we try to make older people and also people with dementia to stay at home instead of move them to the nursing home. But the challenge is right now, the caregivers, different from the previous year, that we have the problem of shortage of caregivers, especially the family caregivers. So not only the family, but also the responsibility of the people in the communities to help family to care for dementia at home. So for the care costs in Thailand are covered by the universal coverage schemes, and the main challenges is the knowledge, the skills, the awareness of people in the communities. They might not have enough knowledge and skill to care for people with dementia. So the main challenges of Thailand are to raise public awareness of dementia, improve healthcare capacities, and to prepare for long-term care system. That's the situation in Thailand. So why we need innovation and technologies for dementia care? So in the future, Thailand expects to see an improvement in public education about dementia to raise awareness, to improve knowledge and skills of people that involving in caring for dementia patients, and also increase in specialist training involving multidisciplinary teams, especially nursing or nurses, and the sustainable long-term care, community-based care. So long-term community-based care or long-term care in Thailand mostly focus on chronic disease patients in general, not focus only on dementia. And the expansion of an accessible care system with adequate standard for the Thai population. So why innovation and technology is needed? Because you all know that the very difficulty problems of care for caregiver is behavioral and psychological symptom of dementia makes big burden to the caregivers. So signs, symptoms of altered perception, thought, content, mood, and behaviors which occur frequently in patients with dementia. 12 BPSD or symptom of dementia, big burden to the caregivers. Psychological challenges include like delusion, hallucination, depression, anxiety. But behavioral symptoms like wandering, aggression, resistance to care, and inappropriate sexual behaviors, anger, verbal, physical aggression. That's why burden of caregivers. One dementia patient in the late state of dementia, they might develop all these symptoms. That's very difficult task for caregivers, and it takes time to care or to manage all these symptoms. So that's technologies, great potential in the early diagnostics, holistic management of BPSD, and also useful for assist caregivers to provide holistic care to patients with dementia. So diagnosis, assessment, monitoring, entertainment, and engagement, and care and management, all kinds of issues that technologies can help. Example, like digital technologies, great potential in diagnostic support and treatment of neuropsychological symptoms of dementia. So technologies can be a promising solution that meet current and future demands. This is example, 3-4 main categories. But as a nurses, it's a major responsibility of nurses to care for the people, not the people with dementia in the organization, in the hospitals, and also in the communities at home. But before we decide to adopt technologies for improving care of people with dementia, these are all questions we have to answer before decide to use. Ease of use, impact of stress and anxiety for the caregivers, benefit, cost effectiveness, improve patient quality of life, and qualities of device or technologies that we use, promote independence of people with dementia, and also another concern is data protection. Familiarity with harms and benefit. Technology is not only benefit but also may cause harms to both the patients and the caregiver. So we have to consider both harms and benefit of technologies and also align with user values. So as a providers, as a care providers, we have to concern about patient privacy when we decide to adopt technologies for dementia care. So the patient and the caregivers must be informed about data collection and usage protocols. For example, home environment with sensor, patient and caretakers, they must be informed about type of data collected and the frequency and reasons for data collection. And also they can decide to choose what data that is very sensitive, they realistic to give that information. And solution providers must inform them about the privacy list and where to track them. Also, prioritizing patient privacy. This fosters reliable and trusted environment that assess quality of services. Another critical consideration in dementia care when using the technologies is assist patients with psychological distress. So technologies may make caregiver to provide good care for the dementia patient. They use a robot example. And also these are the benefits of using the technology like lower agitation, depression, anxiety, something like that. So before I move to the roles and responsibility of nurses, I would like just focus on the barriers when we adopt an innovative assistive technology. So, for example, maybe the caregivers and the patients in Thailand's lack of experience of technologies. Some of them. Age of the person using the technologies. For the dementia, most of them are elderly. And also in Thailand, in Thai context, the caregivers, elderly caregivers, become increasing right now because the family member, their children, they move out. So let other people taking care of other people. in the family. So age of the person associated with technologies using. Lack of skills to use technologies, fear of mistakes, that is very interesting barriers. Fear of being replaced and intrusive design of the technology. These are the barriers we have to concerns and maybe we have to consider to manage. But for the facilitators, ease of use, we have to consider that. And also the familiarity with technologies of the user, improvement of care, low technical demands. This is very interesting. Personalized fit of AIT to daily routines of the demented persons and also the caregivers. Enjoyment, possibility for new interactions and feeling of safety. Also motivated the participant to use IAT, for example. So before we use AIT, the provision of support is very important. And during using, during the implementation, so it makes the user to accept and adhere to the technologies. So, and the outcomes, what we are going to measure when we adopt technology to improve care, like patient outcome, cognition, there are many indicators of cognitive ability be improved. You can measure several indicators. Functioning and dependency, there are several indicators. It depends on what you want to improve. Like eating behaviors, you might measure appetite or frequency of eating. Independence and autonomies, maybe both psychosocial and physical autonomy. Social engagement, physical health, you might measure fitness, physical fitness or mobility. For the outcomes of BPSD, several symptoms that you can measure improvement of those symptoms. Mental health, maintaining identity or personalities, distress behaviors, that's the, or eating behaviors, as an outcome, several indicators. Not only BPSD, but also quality of life, patient length of life as indicators when you implement the technologies. Patient quality of life, length of patient life, longevities, and stay healthy for as long as possible. This is the indicator you can measure. And also outcomes in terms of caregivers, like caregiver burdens, family participation in care, caregiver social support. They receive support for themselves. That's the outcome in terms of caregivers. Spouse duty to care, quality of patient, caregiver relationship, and also caregiver quality of life. In terms of health, social care, and treatment-related outcomes are varieties of indicators of outcomes. Health services and disease information, stability of symptom and general symptom control, for example. Delay entry into institutional care, medication side effects, and certainty of diagnosis. So I move to the last section, is the loss of nursing in dementia care. Mostly, care of dementia patients belong to the responsibilities of the roles of nurses. So as a nurse, these are several. For example, recognizing dementia. Nurse in the communities, working in the community, especially for the risky group like other people. As a nurse, we have to screen for mild cognitive impairment and also screen for dementia. Early detection, early prevention is the best. And also improve the capacity and medication adherence of the patients. Support patient adherence to prescribed medication. Work with the patient and their family. And improve physical health. especially the dementia in the middle and the late stage, like help them for nutritional status, physical health, and also like bladder training, something like that. Care and communication skill. As a nurse, you need to be able to communicate and also improve the communication skill of the caregivers and the dementia patient themselves as well. Using short sentences, using familiar vocabulary, using warm tone and smile during conversation with the patients. And also environmental adjustment, adjust the environment to make people with dementia stay at home independently as long as possible. These are the roles, responsibility of nurse. For example, personal care, provide care directly or strengthen capacities of caregivers to provide personal care with patients with dementia. So, role of nurse related to innovation and technologies. We not only develop, but also use technology. So the cultures of innovation, as a nurse, we need to promote. Develop the skill to promote innovation. So the skill of design thinking as a leader is a part of professional development of nurses. Conducting tanks to help discover new ways to solve the clinical problems of dementia care. Partner with the academic colleagues to create joint programs and fellowship roles in innovation. Create plan for sustainability and spread by highlight nurses' ideas and elevate the ideas to administration. So that's all. My presentation just mostly focused on the roles and responsibility of nurse about innovation and technology for improving care of people with dementia. Thank you very much.